All right, well, I want to welcome you tonight. We're going to be going over a subject that I've always found amongst the most exciting. We're going to discuss the subject of musicians, hands and wrists, fingers and arms and shoulders. This is an area that you'd say we have some worldwide reputation. I think we're the only non-surgical, non-drug healers in the world. That virtually all the major music magazines come and interview me on our work on fixing up players' hands problems. We've had more than hundreds. Now you'd have to say thousands of musicians who have come to me with tendinitis, carpal tunnel syndrome, wrist pain, hand pain, forearm pain, numbness, weakness, lack of strength, lack of endurance, lack of control, lack of ability to get their licks put together the way they want, and involving all types of instruments, from guitarists and bass players to violinists, from saxophone players to drummers, and just about every instrument, whether it's a flautist or a bagpiper, I've treated for arm and hand types of problems. I guess you'd say I fell into this specialty more out of love. You know, some doctors are jocks and they're always at games and they're taking care of athletes. That just doesn't happen to be me. I love music a lot more, and somehow my friends are always musicians, and so when they ran into problems, I did research on how to fix them, and by some stroke of luck or guidance, however you want to think of it, I was able to meet about 20 years ago probably the top extremity technologist, researcher, fixer-upper on the planet. There's a fellow named Dr. Zindler out of Vancouver, British Columbia, and I realized when I saw him that I was in the presence of some unusual genius. And we have taken techniques that normally doctors, physical therapists, and chiropractors have never seen, never known, and never been able to do, and brought them here and then refined them. He's a hockey player, and he's up to his ears fixing people who hold hockey sticks and who screw up their knees and their elbows and their wrists playing sports up in Canada. And I was always working with musicians down here and refining our techniques to the point where when the editor of Guitar Magazine, now the biggest music magazine in the world, ended up with a finger problem that no one could fix in New York, he flew from New York out to LA and we had him fixed in a day. Now not all problems fix in a day. And I'll be explaining to you how long certain problems do take. There are built-in time factors in fixing things. So I don't want to give you the false idea everything's fixable in a day. It's not. And when we fixed a number of well-known players, different of the music magazine editors called me, and that's the reason bass player, modern drummer, guitar player, banjo player, all of those magazines, guitar, come out here and talk to me. And I do get calls from all over the world from people who have hand problems. And hand problems to a musician must be every bit as spooky as they would be for me if I didn't know what to do about mine. I mean, none of us really can get by without our hands and arms, but certainly most musicians couldn't possibly apply their art without them. And I have taken care of and fixed up musicians who literally had their lives vanish in front of them, their whole creative world gone when they can't play. Some people get to the point where it's not just painful, it's not just unpleasant, it becomes impossible to even play. You don't want to get to that point. Hopefully none of you are. But I've certainly fixed enough people, some who have a lot of foresight and catch problems when they're early and say, hey, let's fix it up while it's something small and it's not a project of any great magnitude, and some maybe have been trying to get answers and they've had problems for years and they've finally gotten so severe they really don't know what to do anymore. And they're so depressed they're just ready to jump from a tall bridge. So we've seen quite a gamut. This is an exciting area to me because what I'm going to go through with you tonight in terms of my work is some of the most rewarding. We take people like Vic here. You came to me, well, you're just really done with treatment. You're just here for the class tonight. But you had hand problems for how long?
2.5 years plus.
2.5 years plus. Tried different things. Saw doctors. And, you know, go the usual route. What did they do with you?
Not much. Some hands-on examination and nerve testing.
Nerve testing, examinations.
Zip diagnosis.
Couldn't figure out what was wrong. Give you some drugs to take?
No.
No? Didn't give you any braces to wear?
Tried a hand brace, but they weren't even certain that was relevant. It turned out to be causing more problems than it was.
Yeah, medically, you go into a doctor's office and he may know nothing or may think he's a world expert. And medically, they'll test you and come up with some buzzwords. It's a tendonitis, it's a this, it's a that, it's a rotator cuff tear. They got it sounds gorgeous. You think, boy, the guy must know his stuff. But then, well, here's some drugs to take, maybe some non-steroidal anti-inflammatories. Oh, that didn't work. Let's shoot some, excuse us, can we turn that off? Whoever's beeping there. Shoot cortisone into that joint. Oh, that brought temporary relief at best, and then it usually comes back again. Oh, let's put some splints and braces on. And you look stupid, and you got people, I got people coming in here, they've been wearing these stupid braces for 3 years. You know, I mean, how could that be working if 3 years later the person still got the same problem? You know, and then finally, the last resort or the last ditch, if it looks like there's some logic to it, is to perform a surgery. Oh, let's cut on, you know, your fingers, let's cut on your carpal tunnel, let's cut on your wrist. And then what happens? Patients come into me and they've already had failed surgeries. Years ago, when I took care of one of my first guitarists with a problem, some of you may have known Les Wise, who was one of the founding instructors at Guitar Institute here in LA. Long-time player, long-time instructor, double failed carpal tunnel surgeries. That means 2 on each wrist. They had done both sides twice. Surgery once here, surgery once here. Didn't work. Surgery a second time here, surgery a second time here. Still didn't work. Came to me, and within a matter of weeks we had him out of all pain. He'd been in for, I think it was almost a decade, all the failed surgeries, and he was just blown away. And, you know, I was a guest lecturer at MI, hooked me up through the musicians union. There was nothing, there was no door that guy couldn't open because his whole life had changed, and he had been trying medically to fix these hand problems for a long, long time. Tonight I'm going to go through with you a large view of this whole subject. I want to be able to discuss the cause of problems, the prevention of problems, exercise, nutrition, repair, what goes wrong, how you fix it. I mean, I'm really going to get through this from soup to nuts with you today. So it's pretty exciting that we'll cover this whole subject this evening. We're going to deal mainly with hands, wrists, forearms, elbows, arms, shoulders, and that even hooks up to the lower neck, so we'll have to include that when we discuss everything that can go on from here down to the tips of your fingers. And as I mentioned earlier, the chief complaints that get people going, they know they've got problems. First is pain, second is numbness, third is weakness, or lack of strength, lack of endurance, lack of control. These are the common things that plague musicians. Everything we're going to talk about tonight applies not only to musicians, nearly all of it will apply to computer operators, grocery checkers, people who twist wrenches at Mr. Goodwrench. There are lots of ways to screw up your arms and hands. You don't have to just have a guitar in your hand. And the same information we'll talk about tonight involves the whole large field of what goes on in arms and hands for anybody, whether they hurt them playing tennis or working at a computer. Basically, there are 2 main ways to screw up your arms or hands or wrists, fast or slow. Those are the 2 ways you can get there. You can screw them up fast or you can screw them up slow. Fast is by injury. You can suddenly injure your wrist or your elbow or your shoulder or your neck, and at one exact moment in time, at exactly 12:31 p.m., at exactly 1 minute after the hour and 30 seconds into that minute, some injury occurs and a problem follows that. And we're going to discuss those injuries and how you can sometimes even injure yourself thinking you're doing yourself a favor. There have been more than 100 musicians I've treated over the years who injured their hands doing push-ups thinking they were going to help themselves because they didn't realize that if you're going to do a push-up, you better know how to do it the right way. I'll teach you how to do it. And they think they're doing themselves a big favor and gave themselves something called carpal tunnel syndrome as a result. The fast way is injury. Suddenly there's enough force applied to one of these areas that it's torn up and damaged. The slow way hasn't usually been understood till recently, and then it's been seen so much it started being given names, and that's the area known as repetitive stress injuries, cumulative trauma injuries. These are the terms that are used now, because it used to be that in the workers' compensation injury area, people at work, it was always, well, I went to lift that box, and at 11:22 on Friday morning I lifted wrong, and suddenly I was like this. Fast injury. And then there began to be as many injuries of people who worked at computers all day, and their hands were crapping out and they had problems. And there was no obvious immediate incident of injury. It was the repetitive use. And who ends up using their hands so repetitively? Instrumentalists. I mean, really, most instrumentalists are a very specific type of athlete. You are demanding a level of output, performance, control, endurance, fine muscle control, activity on a repetitive basis that the average person does not. In fact, in my research now, having fixed thousands of musicians, I would tell you that many musicians had their problems develop and start over here, but be discovered by their playing, even though it wasn't really started by their playing. It was disclosed that they had problems they may have developed falling off a skateboard, banging their head surfing, in a car accident 7 years ago. Totally different source of problem, but when they make a demand on their hands that most of us will never make, and on their arms, they are aware that they are not able to deliver what they expect. They aren't able to perform for 2 hours or 3 hours without problem. You could take a lot of other people who had similar injuries, and if you were to make the same kind of demands on their hands, they would find it. But they don't make that demand, and they don't discover it as easily, unless they're working at a computer all day or writing, you know, there's some script editor and they're writing on a piece of paper all day. They might discover it again by repetitively having to use it. The idea that it all comes from repetitive stress probably isn't really valid, as much as many of these things are shown up by repetitive use. But this is how the medical field likes to think of it now. Oh yeah, well, it's the repetitive use of sitting at your computer that messed you up. We study and we can see that their problems really didn't start with their computer. There are ways to know that, and I'll clue you into some of them before we're done tonight. So we know their problems started before they even saw a computer with some of these people. And yet it seems like it came from the computer, and in a way it did. If they weren't making that demand, just like if you weren't making that demand of having to play your bass guitar, you wouldn't probably know the limitations that you're experiencing. The idea of cumulative trauma or injury both have a lot to do with your tissue strength or your tissue weakness. Think about it. It's only logical when you think about it. Certain people tear up ligaments and injure tissues in their body, and others don't. What's the difference between two people of essentially the same build and strength, or maybe they even got different builds and strength, doing the same kind of work, and one of them's ripped up and the other one isn't? Logically, you know that some people have stronger tissue than others. They're better nourished than others. Their tissues are in better shape than others. And if you have weakened structural tissues, we'll talk about what the important ones are tonight, you're going to be the person who's prone to an injury, whereas the guy who's strong, who's next to you, does the same thing and isn't. Some musicians are pretty funny. They wonder why they've got so many hand problems and they live on pizza, beer, and Coca-Cola. It's not such a wonder for those that are doing that, who are systematically undernourishing these tissues that hold things together, and wonder why they fell apart. There are ways to hold together. I'm going to cover them with you tonight. I'm going to go through prevention and strengthening and the nutritional side of this, which should never be overlooked. And let me tell you, by the time medicine and the workers' compensation system come around to thinking about nutrition, we're going to be very old gray people. They're slow on the get-go when it comes to nutrition in the medical field still today. It's like a new frontier for them. They barely arrived. Injuries to the wrist and hand can come easily from a fall. When you fall down the stairs on a wet floor, off your roller skates, off your inline skates, the first thing you try to do is catch yourself on your bent back wrist. It's the thing everybody does. By the way, if you're a skater, wear wrist guards. For sure, for sure. If you wear no other protective equipment, wear wrist guards. And have a nice stay, hard stay here on your carpal tunnel area. Because you can give yourself what's known as carpal tunnel syndrome, getting a little ahead of where we are tonight. You can take this tunnel of these bones that form a tunnel through which all the plumbing and wiring of your hand travels, and you can just flatten those bones right out and tear those ligaments if you land hard like this. I don't think Chick would mind my saying Chick Corea is a very creative guy. I call him the professor. He's a musical genius, Chick. And one day he got into an idea he was going to play his piano without the keys. So he opened it up and he started banging on those big piano strings with the heel of his hand. Some people are builders and they're going to like fix things into the wall by slamming things like this. You probably tried that at some point. I have. These are all ways when you put pressure into the bent back wrist, you're going to ask your body, well, how strong really are these ligaments? Because if you bring enough force that can micro tear those ligaments and do this, you've got something called carpal tunnel syndrome. There's no longer a tunnel. And when the tunnel isn't there, these nerves that require passage, they get through that tunnel. Suddenly, the Jolly Green Giant's foot is stepping down on that nerve. These bones are sitting right on the nerve. And of course, signals are going to be interfered with, and that's what carpal tunnel syndrome is. Of course, surgeons think they're going to have to cut on you. They're going to have to open up your wrist and and slice this, slice that. My question is this. If it didn't take a knife to screw the thing up, does it necessarily take a knife to fix the thing up? Logically, if it was some force that you could apply that did this, isn't there some force you could apply that would do that? Yeah, there is. I'll show you what it is before we're done tonight. I'll show you how we can test for this and know which of you guys have that problem and which of you don't. Because let me tell you, many times it's hard for the medical physician to ever figure out. Their testing is so inadequate compared to the things I'll show you tonight. Figure out where your problem's really coming from. Get glorious names for it and have beautiful Latin. And if all we had to do was pray and go visit the Vatican and say it in Latin, it would be a wonderful world. But getting the Latin is not really what you need. We need to know what's wrong, how exactly it's wrong, and then how you're going to fix it. If it's going to be practical, you got to know how to fix it. Push-ups, as I mentioned, same deal. Hey, you got ligaments made out of pizza and beer, and you go and try to do pressure on your bent back wrist like this? You think you could tear and give yourself carpal tunnel? I've seen it time and again. You want to have strong ligaments. I'll show you how to do it. Nutritionally, you want to keep those areas mineralized. Minerals, the word minerals is a beautiful word. Everybody needs minerals. And you want to make sure you got minerals in your system. You want to live to a long age with beautiful ligaments and bones that didn't fall apart. You don't want to have osteoporosis. You want teeth still in your head. You want jaws that still hold the teeth in your head. You don't want to be paying a dentist to be shoving new plates in that don't fit because your jaw's eroding and you got all these problems as a musician. Here's a gorgeous word, minerals, and I'll show you how to use them. You want to be using some minerals to heal if you got problems, to keep yourself from getting problems, to keep yourself from getting problems when you don't have them. Car accidents, you've got the entire arm, shoulder, hand switchboard of nerves comes out of your lower neck. How frequently do I test a person and their lower neck is screwed up? I don't know how anyone lives a modern life and doesn't mess up their lower neck. I can't imagine who that person would have been. They couldn't be driving in LA because you can be a great driver, but everybody else isn't. You know, and sooner or later somebody cracks into you. You know, you can't be doing normal stuff and not end up screwing up your lower neck. That just happens to be the musician's lifeline, just like it's the chiropractor's lifeline. That's all the nerves that go to arm, shoulder, and hands come out of the lower neck, the most prone area of the spine to damage. And do people know how to fix it? Unfortunately, most don't. Can medical doctors fix it? When you go and you have an accident, you go check in with your attorney and he sends you to some medical doctor's office and the guy, you know, massages you for a couple minutes and throws some heat on, kicks you out the door and sends the bill to your attorney and it all just heals wherever it is? No. People don't get well doing that. They heal wrong. The attorney loves it, he gets paid. Doctor loves it, he gets paid. You get a degenerative spine. That's how you get paid. You know, maybe you walk away with your $3,000 or $5,000 and you've set a time bomb in motion that over the next 10 and 15 and 20 years, you have a degenerated lower neck, which is the lifeline to your arms. With repetitive stress, you got motion, fast movement, flexion. You got in certain instruments absolutely weird positions that you've got the wrist or hand in or the arm in. You got violinists. How natural is this? This is crazy, you know? People who have to hold their instrument like this all day on one side of their neck, do they run into problems with their necks? One for one. Yes. You're carrying your axe around your neck, you got a strap and it's putting weight on your lower neck. You got a big heavy bass guitar here, you got a saxophone here, you got a guitar here. Is that a stress factor on the neck? Absolutely. A unique stress factor to musicians is the strap holding their instrument around their neck and causing pressure on key areas of the spine that relate to the arms and hands. These days I like to talk about this area in terms of something that we've all grown up to learn about now, hardware and software. Because when you've got problems going on in the arms or hands, it pays to understand both the hardware and the software because both of them relate to each other and give you problems if there's a problem there. So let's discuss it. What's the hardware we're talking about? Well, here's the hardest part of the hardware. It's called bone. Here's an arm hooked into a shoulder, hooked into an elbow, hooked into a wrist, hooked into all the bones that make up your, from your carpals here, which are all these little guys that make up the tunnel, to the metacarpals, the long ones inside your hand, and then down to these individual bones that make up your fingers and knuckles and thumb and its joints. This is the hardware, the most internal hard part of the hardware. You got a ball and socket joint in the shoulder, very crucial joint. It's a ball and socket because balls and sockets are used to give you all of this. They're different than like hinge joints that only give you that. Balls and sockets are used in your shoulder, used in your hip when you want a full range of motion going this way and every which way. But they're trick because you got to tie them in so many different ways to get them to not just fly out every time you lift your arm. You don't want it like leaving the room, but be able to go where it needs to go and have all these directions. Come down into an elbow joint, mainly a hinge joint with a special little twist. You got another bone of the two bones of the lower arm called the radius. And the radius has a round head on it. Around that round head there's a strap of ligament. We'll discuss ligament in a minute. And that strap of this white ligament tissue allows that head to twist, which lets you twist. That's how you can take lid off a jar. That's where a lot of your playing motions are going to come from, is you got to have this radial joint working right. One of the most common screw-ups is along this radial line and through that radial joint, whose nerves travel through there and go to your thumb, index finger, and half of your third finger. So crucial. You got problems that are in your thumb, index finger, or half of your third finger, you can almost bet you'll win 90% of the time you got a radial nerve problem. Somewhere that radial nerve's in trouble. Got another bone of the arm called the ulna. That's the other main nerve that goes down into the arm and hand, the ulnar nerve. You got this carpal tunnel I discussed, plumbing and wiring very crucial traveling through that tunnel. It better be a tunnel and not a flat group of bones, or you got trouble. And you can actually hurt individual joints that make up the knuckles or the fingers too. And then they'll need to be fixed if they are hurt in certain ways where they won't. So with hardware, you start out with the bone. And where bone joins to bone, we call that a joint. Where you got bone joining to bone. What's it all about? Motion. Joints are designed so you get motion between bones. That's how you get things moving. What else is part of the hardware? Not quite as hard as bone, but definitely part of the hard stuff of the body rather than just the nerve signals and the software. You've got things called ligaments. Ligament is made up of this material called white fiber connective tissue. And white fiber connective tissue is used a lot of places. We're going to talk about several of them in a moment. When you think about tendonitis, we'll be talking about tendons. Cartilage injuries, we'll be talking about those. Ligament injuries. 3 areas of the body that are all built out of white fiber tissue. White fiber tissue, when it's used as a ligament, is anchored to bone, glued down, anchored to the other bone, glued in place with the body's own glue. And these are living, fibery ropes that hold down, hold in place your joints. Doing what? Enabling them to stay with the bones where they belong, move where they're allowed to move, but not go past where they're allowed to go. If there weren't ligaments going from here to there that are pulled tight when you straightened out your elbow, you'd be just going, whee, and that elbow would go right around. It doesn't, does it? Your knee doesn't go right around, does it? You pull it to straight and it isn't going to keep going. You only get a certain range of motion out of your joints. And what happens is when the ligaments are pulled taut, and from where they're moored to one bone to the next, and all of a sudden, you can think of them sort of like nylon webbing. They're bendable, but they aren't really stretchable. They're not like rubber bands. They're more like nylon webbing. They'll let you bend white fiber tissue, but it doesn't have elasticity in it much to speak of. In fact, if you try to stretch it, something's going to give. It will need to tear, and you don't really want to tear ligaments. Ligaments establish the relationship of joints and establish movement. If you want to know where most people's problems start, they start with having pushed joints past the place they were ever designed to go, and something had to give. And since it takes more force to break bone typically than to tear a ligament, the thing that gives is ligament. Does it usually just tear right off, just snap right off, where a ligament just completely tears apart and there's not one part not attached to another? Thank God that doesn't happen most of the time to most of us. Yes, you can have that happen. It's a nasty injury to completely tear a ligament off, but most of the time you don't see that. What we see instead is a micro tearing of ligament fibers. Ligaments are living fibers. They're all these parallel fibers that make up these ligaments. And when you force a knee to go too far, or a wrist to go back too far, or a finger to go the wrong direction, or a radius to get jammed by hit your racket too hard and you kept putting this force in the radius and eventually overpowered the ligament that held down that round radial head, what happens is the ligaments do this. They don't actually tear off. They micro tear inside where the filaments are torn, the cells are torn, they spill out their cellular guts and a bunch of gook spills out of them. And all that, your body goes, geez, that's some ugly protein gook that doesn't belong here, and it tries to dilute it with water, and you have inflammation and swelling and so forth. I had a guy come to me just recently, and he decided to be a good friend, and he was helping a buddy lift a washing machine out of a truck with 3 other people helping. They lost control of it and they dropped the crate on his ankle and his foot. Now luckily the crate had some little legs on it, so it didn't go all the way to the concrete, but it crushed his foot into a totally weird angle. What did he do? Sprained the shit out of those ligaments. Micro tore those ligaments. Nastiest ankle sprain I've seen in my whole career. I mean, you get a lot of people that just, step wrong and it goes underneath, and you can sprain an ankle like that. You sprain the carpal tunnel like this. You can sprain a shoulder or an elbow. You can grab onto a steering wheel and somebody hits you and you brace, and all of a sudden the impact is transferred from that steering wheel up your arm, and that can micro tear ligaments. The problem with micro-tearing ligaments is this. Can your body heal ligaments? What do you think? Can the human body heal a torn ligament?
Yes.
Yeah, it can. There aren't too many tissues in the human body that it doesn't know how to constantly upkeep and repair. Can it heal a ligament? Yeah, it absolutely can. Because ligaments are made out of white fiber connective tissue. You know what else is made out of white fiber connective tissue? Scar tissue. The cheapest tissue in the human body is white fiber connective tissue. It is the dumbest tissue in the human body. Doesn't do anything all that fancy. Can't transfer light and make electronic signals out of it like your eye. Can't beat like heart muscle. Can't filter blood like kidney cells. Can't do a lot of complex stuff. Make hormones like your thyroid gland does. It just is this ropey stuff that's alive that holds point A to point B. That's what it does. And your body can make that. But after you've done this and flattened out the bones and micro-torn those ligaments because you went past the point where it was holding them there and then something had to give, your body will heal those ligaments. But where will it heal it? Right here. That's where it's going to heal it. And where are you going to be a month and 2 months and 3 months and 2 years later? You're going to be right here. Without what? A carpal tunnel. And then you get to be called a carpal tunnel syndrome person if anyone ever tests you properly, because that's what's going on, is that the ligaments did heal wrong. If you got a neck, and every neck is designed to have a C-curve in it when you view it from the side, but you get in a whiplash injury and you reverse it at cervical 5 and 6 and tear all these ligaments at the back, the most common neck injury. How many of these do we see? How many thousands of them do we see? We see them every day here. That's how often we see that. How does your body heal if all someone does is rub your shoulder muscles and throw heat on you, and that's all they did after that car accident? And that's what the medical profession has been doing with these cases, sending in the bill and just doing that. Does your body heal the ligaments? Every time it will, as long as you got any nutrition going at all. It might be slow, but it'll eventually build white fiber tissue. It'll pull it out of somewhere and come up with some minerals and some protein. You want to speed it up, I'll show you how, but even if you're not speeding up, it will repair it. How's it going to repair it? Just like that, with the curve backwards. And that becomes an ongoing problem because you got nerves that have to get through these holes here, and now you've misaligned the holes, and there's pressure on those nerves. The problem isn't always that the human body won't heal. It usually does. It's just that if you don't undo what you did to it, it gets to heal wrong. It heals just where things are. There's a word for micro-tearing ligaments, for having enough force applied to bones that you have micro-torn ligaments, and now the bones have moved into the wrong position and the ligaments micro-tore inside. And the word is one you've all used and you've all heard. It's a sprain. When we were kids, when I was a kid, you always thought, fracture, broken bone, big deal. Sprain, little deal. Isn't that the way you were taught? Isn't that what you always believed? Broken bone, big deal. Got a cast, everybody signed it, it's very cool. Something big happened. Sprain, some little deal. Why? Because physicians still believe, medical physicians are so inadequately trained on this subject that they even think it's a little deal. I had one of my patients come in who crawled in a couple months ago. Her back was so horribly torn up. And she says, you fixed me, I'm doing this, I'm doing that. I got a girlfriend with the same problem, but she went to her medical doctor and he said, oh, it'll just get better. Just take some more Motrin and go home. Why? Because all these torn ligaments and pinched nerves are little deals until you finally go stark raving mad, and then they decide you're just nuts. Oh, it must be in your head, they think. Until it's their back. You know, and then all of a sudden they start wondering what's really going on. Sprains, we were taught, were these little deals because they're going to heal. But you don't want to know the truth? A sprain can be your worst nightmare. A sprain, here's what happens with bones. You break a bone, fracture a bone. Your body, if those bones are relatively close together, will in 5 to 6 weeks build a cloud of minerals around that bone. You'll see it on an x-ray. Condense that cloud down, rebuild and re-glue that bone together. And over a period of later months, if you had the bad luck that your doctor couldn't or wouldn't bother to put your bones straight and they were sitting crooked like this, after a number of months, your body will even act like it's some kind of body shop, and it'll sand and file this all down and start to smooth it out so it begins to look more and more like straight. It's just using energy to do that. Your body will heal a broken bone in 6 weeks. Unfortunately, it takes 12 weeks to heal a ligament tear, twice as long. And after they've been badly torn, or if they've been sitting out of place for 3 years, 5 years, 10 years, 20 years, and most of my patients come in here, they don't come in with something they tore last week. They don't come in with something they tore up last month. 90% of the patients that walk into an office like mine have problems that started years ago. It's been healed wrong and adapted wrong for a long time before they ever got to us. And then it takes 12 weeks to heal the ligaments after we get things back, and then the body still is remodeling those ligaments just like it remodels these bones and sorting them out for even months after that. Certain fancy joints, like the knee and the spine, you get another use of white fiber tissue in a pad that exists between the bones. And when there's a pad made out of fiber tissue, it's called a cartilage. Same material as ligament, but when the body puts a pad in one of these heavy-duty joints so that bone doesn't grind on bone, then it's called a cartilage, and it's a pad instead of a piece of webbing or strapping that it uses to bind bone to bone. Now it's a pad between bones. What makes up the biggest mass of your arm? Is this the biggest mass of my arm? This bone? No way. What makes up the biggest portion of it? Muscle, right? Muscle makes up the big part of this and an important part of the hardware because it takes up a ton of the space and imparts a lot of the strength. And what do muscles do? They create the motion, right? So you got a biceps muscle up in here, and it has to attach down to your forearm here so that when this muscle contracts, it pulls this bone to that one. And when you contract your triceps down here, it's attached there and it pulls and straightens the whole thing out. That's how those work. When muscle goes across a joint, which is what they all do, and then is adhered to bone at this end and then at this end, guess what your body adheres it with? It's old favorite stuff again, white fiber connective tissue. Gets a different name when it's used to anchor muscle to bone. Now it's called a tendon. Use the stuff to hook bone to bone, it's a ligament. Put it as a pad between bones, it's a cartilage. Use it to anchor muscle to bone, it's a tendon. Your body uses this stuff. You've all seen white fiber connective tissue. You ever ate any chicken or meat or anything? You saw that white gristly stuff around the joints? That's all white fiber connective tissue. It even has it between muscles. Have you ever seen the gristle between muscles? Same material again, white fiber connective tissue. And finally, you come to the most electronic portion of the hardware, and that's what? Nerves. Boy, has your body got a few nerves? How many nerves do you think there are in the human body? There are 1 trillion cells in your body. 1 out of every 15 of them is a nerve cell. You've got billions of nerves in your body. What's the point of those guys? They're electronics. What are they carrying electronically? communication messages. How are they carrying them? To and fro. To and fro where? Connecting up different parts of the body, and especially bringing information through the spinal cord up to central computing in the brain and information back down again. You want to move a finger. You want to hold a pick. You want to finger some reed instrument. You got to have nerves going that are carrying all those signals and allowing the kind of fine control that it takes. Whether you're going to move your mouth to sing a note or move your hand to play a note. All going to be under the electronic control of nerves. Because what? How do muscles work without nerves? Not at all, right? If you have the nerve severed to a muscle, how much muscle activity do you get? It's called paralysis, isn't it? Without nerve information getting to a muscle, you get no muscle activity at all. It's paralyzed. What happens when you get reduced nerve activity to a muscle? What do you get? Weakness, numbness, pain, all those things. When there's inadequate nerve communication, problems begin to develop because nerves are the electronic information flow that runs everything. When you feel pain, what's telling you that? Nerves, right? All pain sensation, what is it? Nerves. That's what's talking to you, isn't it? If you got numbness, what is that? Nerves. If you got weakness, but the muscle looks totally normal on this side compared to the other before it's done any atrophy because you didn't use it, but one side's weak and one is strong, what is it every time? Count on it. It's going to be nerves. Crucial part of the hardware system are nerves. They happen to be the softest part of the hardware system because nerves have the texture of cooked spaghetti. They're relatively soft parts of the hardware system. They aren't made of copper wiring, and they happen to hate compression. As soon as you begin to compress nerves, their ability to do their little electronic dance inside is crushed, and they can't do their little electronic dance, and then they won't carry those signals when they're compressed. I'd have to say that with most of all the years I've spent studying how to fix joints, ligaments, tendons, cartilages, and nerves, which is a lot of what I do here for people, is fixing mess-ups in this arena. I would say that most people who have ever taught me or tried to explain this thing do not get a very clear way of communicating what is observed. And I'll tell you what I have observed. With nerves, you have electronic information. And when you end up with nerve problems, you end up with electronic noise. It's like looking at a TV set and suddenly there's some cross information getting into that signal and all of a sudden it's fuzzy and falling apart on you. And the human body gets a lot of nerve noise when we find these problems. In fact, sometimes the problems become, it's a 1 problem, it's a 2 problem, it's a 3 problem, and then suddenly the problem becomes big enough the whole circuit board just blows out. And nothing works. And we'll have people come in here and they got 1 low back problem, 2 low back problems, 3, bingo. Now you can't get anything running out of their low back. There's not 1 leg muscle working. I've never seen a doctor explain that. I've never seen a medical text explain it, but I'll tell you, I've explained it because I've seen it and I've fixed it and I know what it takes. There gets to be a point where suddenly there's enough noise on that nerve set of channels that the whole board just goes bing. And that's where you get these desperate players who can't play at all because suddenly the nerve boards are blown. Can you fix them? Absolutely. I'll show you how you can fix them. You can actually get it from the point where you bring it down to where now it's discernible noise instead of just this big white burst of meaningless information, and then narrow it down and correct it and heal the thing and get rid of all the noise so that the information's traveling again. The strength is there, the power is there, the pain is gone. You can do it nearly every time. Probably one of the biggest breakthroughs is in a technique that we call proprioceptive technique. We're one of the few places in the world that knows anything about it. And it's a big word, but I think it's one worth understanding, so I'm going to lay it on you tonight. Proprioceptive technique is a technique we use that I'll show you in a moment, what it is, how we do it. And it has to do a lot with the fact that there are proprioceptive nerves and an a function in your human electronic system called proprioception. What is proprioception? It is the control of your body in space, for starters. You're sitting there. Right now, your brain knows where your hand is, your elbow is, your shoulder is, your neck is. It has the whole thing mapped from special proprioceptive nerves that are coming out of every joint. Nerves are funny. Every nerve is devoted to one function alone. So a proprioceptive nerve can't tell you about heat, can't tell you about something else. But it has devoted nerves within every muscle and joint, millions of them, that just send signals up to the brain saying, here's where I'm located in space. So you can do anything at all. You couldn't stand on a leg without proprioception. No way this could be done. And in fact, there's no way if you look at me and you go, wow, look at how he's really standing on that leg. He's just going, I'm going to stand on one leg, but look at all the weird stuff that's going on for him to stand on the leg. This is firing, that's firing, everything's firing to keep me on this one leg. Proprioception is constant, immediate feedback and forth between my tissues, my brain, and those muscles that I do anything stupid like this, that I can stand, walk, kick, play, do anything, write a poem. You couldn't do anything without proprioception. All fine muscle control is under the control of this fine flow of information. And you want to know where the software fits in. When you blow out the hardware and you tear into a joint, and now that joint is out of whack. And now you give it 12 weeks and it heals out of whack. What you get is problems with the software. The proprioceptive signaling system becomes screwed up dramatically. It can be mild, moderate, or severe. It can be anything from a 1 through a 10. And it tends to worsen over time most of the time if you don't fix it. Most of these things actually tend to worsen. And what will happen is as proprioceptive signaling becomes noisy instead of clean, what do you get? Pain, eventually numbness, lack of strength, lack of control. All control, fine, active, rapid control, all under control of proprioception. So when the hardware blows, the problems you begin to discover in the software is what's driving you crazy. It's that inability to get the signaling through that's causing either your pain or your weakness or your lack of control. Well, there's a lot of theory for you. Let's go to something that's got a little more mass to it, a little more understanding in terms of hard stuff you can see. If every one of these problems eventually results in electronic interference, where nerves are failing to signal, which they do, then the cool thing you could do is if you knew how to test these nerves very accurately and correctly, you'd be able to isolate problems. And that's the proprioceptive technique I'm going to show you right now. Since proprioceptive nerves give you strength and control of muscles, wouldn't a blown proprioceptive nerve give you bad muscle response on that muscle? You would, wouldn't it? And if you understood that very well, and you were able to test muscles, you'd be like the electronics technician that could take a bad TV set and run a circuit tester in there, a meter through it, and go, well, there's the problem. There's no juice getting through this one circuit here, pal. We're going to have to replace that bit. What happens with proprioceptive technique is now having isolated, we test shoulders, arms, hands in such a more detailed way than any office I've ever seen do. We go through all these muscles and it tells us exactly what's wrong. When Steve injured his shoulder and a medical doctor looked at him and said, boy, rotator cuff tear, that's nice, Latin sounding good stuff. Boy, I must really understand. You're going to need probably to get an MRI. You might need surgery on that. It looked real severe. He couldn't lift his arm. Was it a horrible injury? What happened, Steve? I took you back in a room and I tested you with proprioceptive technique and then made some corrections.
Yes. I wasn't able to lift my arm, and after he made the corrections, I was able to come this side
Right.
with it. Just in that first time.
That was in a minute. 5 minutes later. And then, medically it was thought, well, he'll have to go to surgery and then rehabilitation, go through all this stuff. But instead, what happened? You were playing baseball?
2 days. Well, I came in for a treatment the following day, and the second day I was playing softball.
Playing softball with that arm, and then went on to win a gold medal, a silver medal, and a bronze medal in the Senior Olympics, all within a matter of weeks. Now, that's the difference between, and a lot of people say, oh, you're just getting old. How old are you, Steve?
I'm 74.
Oh, you're just getting old, they think. I got people, they're old, they're 36. I saw a guy the other day. I put his x-ray up in the view box. I put mine up in the view box. I said, you better wish you were wearing my neck. Because his looked like he was 76. He was 36. I was 46. Mine looked like it was 20. There's a difference. There's a reason why there's a difference there. Now, a lot of people say, oh, Steve, well, he's 74. He shouldn't be able to heal, all this. He heals just fine. What does Steve do that most people he knows don't do? He takes nutrients. He's been doing it for years. Is it paying off? Well, he just won the silver, the gold, and the bronze after a nasty injury in the Senior Olympics. Is it paying off or isn't it? Maybe it's just a wild coincidence. No way. No way. And I put you on some corrective nutrients for healing. I'll explain to you what you use in an acute case like that, what we used with him that turned that thing around so fast and took his healthy 74-year-old body and put him right in the house again where he's doing what he needed to do and healed as good as any 18-year-old would have hoped to heal from that injury. Who's someone here I haven't tested? Someones here I haven't tested who have got arm, shoulder, hand, or wrist problems. I want you to come on up. I want several of you to come up here. So I'm going to test each of you. And if there's 4 or 5 of you, that's great. Come on up, come on up, come on up. Stand right here. Come on up. Doesn't matter which order because I'll get to all of you. What's your name?
Yvette.
Yvette. Yvette, what bothers you?
Well, I'm a pianist. And
Pianist?
These
Yeah.
two fingers.
These two fingers, they curl in. Now when it's the two fingers, here and here, I mentioned half of something, but I'll tell you the other half. I told you there's one nerve that goes here. And I mentioned there's another nerve. Guess where it goes? Here. That's where it goes. That's the one called the ulnar nerve. Let's just see, Yvette, if it's an ulnar nerve problem or not. Right now, our first guess would be something screwing up her ulnar nerve. Let's have you lie on your back, face up. Was it this side?
This side.
This side. You know what? I'm going to turn you around because it'll be easier for the camera to see what we're doing here. So can you place your head at this side? Yeah. Now I'll tell you a technical but important fact on fixing up arm and hand problems. Because nerve information flows from central computing down to reach the fingertips, some wrist problems are in the wrist. Some wrist problems are in the elbow. Some wrist problems are in the shoulder, and some wrist problems are in the neck. A few years back, I fixed a guy who was voted for a number of years running the top bass player in the world. That's Billy Sheehan. He had a wrist problem. His wrist problem was in his wrist. And where'd we fix it? In his wrist. He sent in a buddy of his, a superb bass player named Stuart Ham. He had a wrist problem. If you asked them about their wrist problems and talked to them, they told me exactly the same story. There was no way I could have guessed which one was where. But I tested, and Stuart's wrist problems were in his neck. We had to fix his identical sounding wrist problem where it was compressed up here, whereas with Billy we fixed it down here. Both of them were totally out of wrist pain. And we sent in every friend they knew for me to fix. Still do. What that means technically is when a person says, I got a problem down here, which is in their ulnar nerve, probably along their ulnar nerve. I don't know yet whether it's compressed in part of the carpal tunnel. I don't know yet if it's compressed where the ulna is misaligned in her elbow. I don't know yet if it's compressed in shoulder injuries she sustained, which we'll do 6 different tests for the main ones, or whether she's hurt her lower neck and compressed her ulnar nerve. So what do? We test it all. Here's where we find so many stupid mistakes are made in fixing musicians' arms and hands problems, is that doctors have learned to get this mouse-eyed view of the universe, so many of them, and they think when you say it's there, it better be there. But sometimes it isn't there at all. They should know better. Every one of them studied neurology to get through med school. But because all neurology hooks up to, for most of them in the end, is Tylenol 3, Vicodin, and morphine, and aspirin, it all doesn't really matter, does it? Because you're just going to throw some chemical at it and try to mask it over anyway. Unfortunately, that's why the precision never occurs. So we can start at the top and work our way down. Hold your head up, turn it to the right, don't let me push down. You resist Yvette with all your strength. We test her neck flexor muscles. Those are these right here. I tested the left side. It's great strength, very normal. For a woman of her size, quite normal. Hold, we'll test her right side. Let's compare. Hold. Her left side's brilliant. Her right side's 20% off. It's not a blowout. Before we're done tonight, you're going to see some of these blow out probably, because there's hardly going to be 5 people I'm going to test and their necks are going to be that good. Certain whiplashes will leave a person with blown out flexors on one or both sides. She has a partial, mild blowout on the right. Is there a problem in that area of the neck? Yes, it is. Is it 10 on a 10 scale? No. It's probably a 2. Should you fix it? Well, unless you like 80% function, you'd fix it. Because every time you leave one of these circuits just a little bit blown, it's still that much blown. And what happens is you add up this much of a short circuit here to that much of a short circuit here to that much here, and by the time you hit the end of the line, how's that screen looking to you? Whole lot of noise. You go through the shoulder, don't let me pull out, hold strong. Beautiful first rib test. Haven't had a lot of car accidents?
Yeah, I have.
You have had them? Got good care afterwards?
Well,
Reasonable?
No, it took me like 15 years before I had. My doctor said I was okay at that time, but I think I had problems.
Yeah? Did anyone fix you properly, ever?
I'm not sure.
Not even sure. Lock the elbow. Don't let me pull down. Now, these next 4 should all be equal. Hold. 1, 2. See, she's even trying to turn her arm because she knows that one's going to go weak. People will always cheat on a weak test because they think it's a contest and they want to win. But we test these 4 tests like this. 1, we pull out to the side, check how her first rib sits under her collarbone. Not a problem there. Keep it turned just like that. Don't let me push down. Ball and socket joint test in her shoulder. Not very good. At least 50% down from what it should be. Hold. Collarbone. Collarbone where it joins the breastbone. Hold. Those 2 are okay. So the original 4, we've only got this one blown. Are we going to need to fix it? Yeah, unless we'd want to leave her with a percentage of her problem. Now don't let me push down. The 7th neck nerve we'll check. That's the deltoid function. Let's compare it to the other side. Deltoid muscle lifts your arm. It's good on that side, not good on this. What do we know so far? We know that in a series of tests going through her neck and shoulder, she's got more problems on this side than she does on that. Did you notice that? And her symptoms are on this side. Let's come down to the ulnar nerve. Hold these 2 together. Don't let me pull apart. Let's compare it to the other one. Now, most players have exceptionally strong hands. Hers are so strong that on this side, are you right-handed or left?
Yes, right.
Right-handed. Her left hand is so strong, which isn't her dominant hand. But her dominant hand, which should be 10% stronger, is 40% weaker on what we call the ulnar nerve test. I'll show you how to do this on each other in a minute. Now we'll go down to the radial nerve test. Same test, but now we point the fingers footward. Strong as a bull. Real nice again. Come up to the ulna. Can't withstand that much pressure. What do we now know? She's got an ulnar nerve problem for sure. We're going to go and fix every one of these strength tests so that there's no noise on any of these nerve networks. Get her neck giving us full strength on the right. Get her ball and socket joint giving us, on the right, giving us full strength. Get her ulnar nerve giving us full strength. And we'll check her for carpal tunnel. Face the fingers out this, triangle shape with thumb and little finger. Not a carpal tunnel problem. This is going to baffle the heck out of a doctor. You giving this to any doctors to look at?
Yeah, they can't figure it out.
They can't figure it out. They cannot figure this one out. There's no way for them to figure this one out. But you want to know, if I weren't talking to you, how long it would have taken me to figure this one out? This would take about 90 seconds. That's how long it would take to figure this one out. Would we want to shoot a picture or look at a recent picture of her neck? For sure, because there's some problem in there at the C5-6 level. And we're going to correct her shoulder, no big deal, and straighten out her ulnar nerve, and we should get power back in, because what's happening is her extensor muscles are not working on that hand and it's dropping down. Before we're done, I'm going to show all you musicians exercises for your extensor muscles. Almost all musicians play in flexion. And the nerve system operates in a yin-yang kind of thing. It's got to have flexion and extension. All muscles have built-in flexion and extension. The problem with most physical activities and with musicians is that almost all your playing is in flexion. And you don't use extensors enough. And you're always overpowering one side of your nerve system and one side of your muscle system while you're shutting down the other, because the nervous system is pre-programmed so that every time you flex a muscle, it automatically shuts off the opposing muscle group, or else you'd be going, I want to bend my finger, oh, I want to bend my arm. It'd be ratcheting trying to get there. But the circuitry's pre-programmed that every time you fire your biceps, it inhibits and turns off the nerve to your triceps. And everything is like that. Well, what happens when you fire muscles in flexion all the time, but never in extension? You're always powering one side of the nerve system, one side of muscle groups, and never the opposing group. So with the vet, we'd end up correcting the nerve system problem and then putting her on some extension exercises that I'll show you. Thank you very much. Your name is?
George.
George.
Nice meeting you.
Nice meeting you. Where's the problem, George?
There's 3 fingers, like you read.
Thumb, index, and third?
Middle.
The middle, yeah.
Right, and numbness in the hand. Some pressure in the elbow area.
In the elbow, and on the right side.
Right side, yeah.
What do you play? Keyboards. See, this is the thing. If it were guitarists, 80% of the time it's left or both. But with keyboardists, it can be either. It can be right. You see a lot of left on guitar and bass players. Let's have you again lie at this side with your head here and your feet on that side. Usually I set the table up this way because I got a lot of string players and I'm fixing a lot of lefts, checking a lot of lefts. So he says his problems now are going down the other nerve, radial nerve. What do we think we'll probably find? Radial nerve. Where do we know it's going to be pinched? We don't know yet. We just got to check and see. Hold your head up, and George, turn it this way. Don't let me push down. Very weak on the right. Hold. Not so weak on the left. You guys should meet each other. You and Yvette have got a lot in common. Hold the arm up, lock the elbow, George. Don't let me pull out to the side. Check the first rib test. Nice and strong. One of the most common ones to blow out. Not on these two, but it is very common. Hold. Check the ball and socket test. Keep it locked. Don't let me pull down. Little sponginess there. Very common one to be weak if there's a problem. Lock the elbow. Lock it straight. Don't bend it for any of these. Hold. No collarbone. None on that one. Nasty collarbone on this side. Hold. He hurt his acromioclavicular joint, which is often a sports injury. Used to play some sport where you ever remember damaging your collarbone or shoulder area up there?
No, I did have a car accident 2 years ago.
Can happen in a car accident. He's got nerve noise coming out of the acromioclavicular joint, and it'll jam this nerve flow that lets him hold the arm. Resist me. Lock the elbow in this position. And he goes dramatically weaker in that position than he does in this one. These two should be equal. Keep the elbow locked. Hold. That one's strong. That one isn't near so. We've got to fix the AC joint, it's called. Then we come down. Oh, let's do C7. Very common problem. Comes out of the very lower part of the neck, goes into the deltoid. Hold. Strong deltoid. No big deal there. Ulnar nerve. Fingers point up. Hold together. Hold strong. Don't let me pull apart. Check's good. Radial nerve. Don't let me pull apart. Hold together. I mean, he's already failing before he even started. Can you even feel that? It's just shot. Nothing on the radial nerve. Everything when he keys in the ulnar side. Nothing when he keys in the radial aspect. As soon as that arm turns, all the noise shoots. Now, if you turn your piano upside down and suspend it from cables, play like this, you'd be in good shape. Or, what? We got to fix the radial nerve. Correct the lower neck where the radial nerve starts from, and then usually catch it right in here. Usually if this were a good actor, he's a pianist, they'd be going, yeah! Is it a little tender in there?
Yeah.
Yeah. A little too much German in your background there, George. Yeah! Because that's intense in there. I can even feel the pressure that's in there. Going down the radial nerve, and it's causing a radial nerve weakness. That's what's weakening into the thumb and index finger and into the middle finger. Thanks, partner. Good job. Your name?
Ben.
Ben. Which problem you got, Ben?
A
little of this and that, huh?
Yeah, I do body work and a lot of shiatsu, and this got real busy 2 weeks ago, and I think it's just directly applied here.
Into the thumbs particularly? Going into the thumb?
Yeah.
Now sometimes you could hurt a thumb if you're applying a lot of pressure into it. It might be a thumb problem.
It's also on my kayak,
Yeah.
I'm a kayak surfer, so I'm doing all I can to damage myself.
Are you? Okay, let's have you lie on your back with your head up here. What's the rule we follow if it's down in the hands? Test everything from the top down. Now I'm not running every test, but I'm running a lot of the key ones. Turn your head this way. Hold it up. What's your name again?
Ben.
Ben. Don't let me push down, Ben. Hold. Try this one. Turn it. Don't let me push down. It's got a very weak flexor group on this side compared to the other side. Problem in here. Some old whiplash injury. Is this common? Oh yeah. Why is it that it gets weak on these 3 people I've tested on one side and not the other? I'll show you. When the vertebrae are straight, you get signals through. When the vertebra twists to one side, what happens? You pinch one nerve, not the other. The other one opens up. This one pinches. So what do we know about his C5? It's twisted. It's rotated, pinching on the left, not on the right. If you manage to jam the whole thing into a malposition, one relative to the other at the disc, you can pinch both sides. But if you rotate it, you'll pinch one side, and then you get one neck flexor weak like he has, and that tells us we're going to have to fix that side, which is weak over here. Then we go through the shoulder again. Why? He's got a thumb problem, but we don't know where his thumb problem comes from yet. Hold. Don't let me pull out. Nothing wrong with the first rib. Don't let me pull down. Nothing wrong with the ball and socket. Don't let me push across. Nothing wrong with that side of the collarbone, breastbone side. Nothing wrong with the other side. Those basic 4, all equal, all strong. Hold. Nothing wrong with the deltoid. Radial. Hold together. This one tests the nerve that goes into where? Thumb. Ulnar. Look at the difference. The little finger side isn't his problem. It's all on the thumb side. Does he probably really have a true thumb problem? No. If your brain has a pinched nerve and the nerve goes to your thumb, where does your brain tell you your problem is? It tells you it's in your thumb. If you have a pinched nerve that goes down the side of your foot to your little toe, you could pinch that nerve in your low back, but where do you get your pain? The side of your foot, wherever the nerve goes. He's got a radial nerve problem, for sure, for sure. Because if it were in his thumb, he wouldn't be able to hold this. So that's what we end up having to fix. Good, partner. Good job.
John.
Yeah.
How you doing?
What's your name?
John.
John.
Yeah.
Let's have you lie on your back, face up.
Which way, this way?
What are we looking at?
I get numbness in my hands.
Both of them get numb?
Sometimes I wake up, I can't even feel my fingers.
Can't even feel your fingers when you wake up. Let's start with you face up. Head here. Now when a person says they got equal problems into both sides, this is my train of thought. Either lightning struck twice exactly on both sides of the body, doesn't sound so likely, or something that both sides have in common must have a problem. So what is it that both hands have in problem? The only point they conjoin is in the neck. That's the thing they have in common. So 99% of the time when a person says I got pain going, I got numbness or pain that goes into both sides and it's fairly similar, They almost always have a neck problem. Turn your head this way. We'll start with the flexors and see how they're doing. Shot on that side. Hold. Shot on that side. First guy you found where it's blown both right and left. Problems on both right and left sides. So we go down. Now when a person hits numbness, usually speaking, they're in worse shape than a person in pain. I took care of a guy guy named Al I started with 5 weeks ago. He had numbness and weakness and had lost all his muscle bulk in a matter of months out of his chest and down into his arms and was completely numb in his hands. 2 different surgeons said they were going to open up his neck from the front, steal bone from his hip, chip away all the bones in his lower neck and fuse him, jam it full of bone chips and glue him together. And since he was losing all the use of his arms and hands and felt like total shit, he was like, geez, this sounds bleak, but what am I going to do? I talked to him yesterday. He said, Doc, over the weekend I had no numbness at all, no sensation of anything wrong at all. He'd been steadily improving from day 1. The first day I adjusted him, he goes, whoa. You know, it was already a big change. 5 weeks into this, and by the way, how long do ligaments take to heal? 12 weeks. He's not even halfway healed yet. And he came into me and goes, you know, all this weekend I worked, I got no numbness, I got no pain, I got no nothing in the arms anymore. The last of his symptoms hit 0. And he's still only halfway healed. Hold the arm up and don't let me pull out, John. Hold it. And keep the elbow locked. Don't let me pull out. Now here's the first guy we saw with a blown out first rib test. Lock the elbow, don't let me pull out. Completely weak. He's trying to bend his arm. Don't bend it. Just keep it straight. It's completely weak. That's a very common problem where the first rib has been whiplashed or moved forward underneath the collarbone and it's shorting out a major circuit board underneath the collarbone. It's going to need to be rapidly reset into position and it'll turn that power right back on. Hold strong. It's blown out on the ball and socket joint. Oh, it's blown out on the collarbone. It's blown out on that one. How's this? Hold. Hold together. Nothing. He's like, it's just ridiculous. Hold together, these two. Hold. Nothing. Now remember I told you something earlier. I've never heard any doctor ever define it, but I told you about it because I've seen it so many times. What's happened is his problem was a problem, was a problem, was a problem until finally the whole circuit board just went. And what does he have? Numbness in both of his hands. He wakes up in the morning, he doesn't even feel them. And what do you see? He's failing every bloomin' test. Does he really have every one of these joints hurt? Wouldn't bet money on it. It's probably 3 or 4 of them, but it's not 8 of them. But they're all screwed up, aren't they? You know, I'd seen this so many times and I finally made sense of it because we never had to fix all of this. What we'd end up doing is fixing, I'd start with the neck and I'd fix that and all of a sudden 4 of them would disappear as problems. And then I'd fix one thing in the shoulder and 3 of them would disappear. And then I'd catch one more thing in the elbow and the rest of them would disappear. It looks like he's got all these different faults. Because what happened? There gets to be a point where 1 and 1 makes 2 and 2 and 2 makes 4 and then all of a sudden 4 and 4 makes 28 and the whole thing just goes and explodes into a complete blown circuit board. And that's what's happened. And it's probably happened on his other side too. Otherwise he wouldn't be having matching symptoms. Lock the elbow. Don't lock it straight. Don't let me push down. Weak as a kitten. There's nothing there. Don't let me pull out. Weak as a kitten. Okay, so I want each of you to pair up with a partner and just test here and see. Put your thumb and little finger together. And try and tell the person, don't let me pull apart. Your 2 fingers go inside the thumb, 2 fingers inside the little finger. Their thumb and little finger go together. Your thumb stabilized. First point their hand headward and have them resist and test and see how strong they can hold together, what it takes before you overpower them. Then turn their hand footward and do the same thing. And notice if they're the same or different and if they're both strong. And then change partners and do it with where one of you is doctor and the other one patient. You notice any weak ones so far? Find any ones that were different? From right, left, up, down? Check right side and left side both in up and down positions. Do you see any that were different than others? All 4 of them should be equal, roughly equal. That's ulna and this is radius. I misnamed some things with you, and we're going to have to recheck that with you. Sometimes you find paradoxical findings, and I'll explain to you later what that means. It's probably, actually radius, ulna is up, radius is down, and carpal tunnel is out to the side. Carpal tunnel inflection, which will be aggravated by players, will be inflection, and you can also test it in extension, which you'll find with certain instruments, where carpal tunnel problems are aggravated in extension or aggravated inflection. Do you find some weak ones along with the strong ones, any of you? They're there, huh? You can find them. They tell you that when a person's nerve energy isn't traveling down that nerve network. So, John, you were about to say you saw a doctor and he said what?
They gave me some injections.
Gave you injections?
Yeah.
Cortisone, prednisone?
And it was okay for a while, and then it started acting up again.
Started acting up again. They injected him with cortisone. It got okay for a while, and it acted up again. Cortisone is the strongest anti-inflammation substance in the world. It is also the most dangerous. It has the worst side effects. It causes degeneration of bone and joints. In the medical books, what does it tell us about cortisone, Dr. Akar? Very bad. Would you want, as a musician, to inject it into your arms and hands, or are you going to you wouldn't want to. And they inject that in there, and you get a temporary relief. Why? It's the strongest anti-inflammatory substance in the world. It's the best spray paint over a problem you could spray, except it's the worst for you. Would I ever let anybody inject cortisone in my wrist? No way. Not a way. And what happens after it wears off? What happened to him? It all comes back. Why? Because he doesn't have a problem that giving me a temporary burst of cortisone is going to fix. Cortisone actually is an important hormone in the human body. We're going to talk about it before we're done tonight, because a lot of musicians' problems are aggravated by their body's failure to output enough cortisone. But you can't fix it by giving you someone else's cortisone. You can only fix it by fixing your body's own ability to generate cortisone. You were one of those people. Had exceedingly worn down adrenals, the glands that produce your own cortisone. If you don't fix that, you will never get out of the inflammatory conditions you've got. And then your depression stays, and all the other things you had going on with low blood sugar and depression, as well as all the wrist pain, was never going to heal until we did what?
Yeah, repaired the glands.
Repaired your adrenal glands. Got you back to health, and now all that stuff's a thing of the past. So what we got going with John here is everything is blown. By the way, when they inject him with cortisone, it can worsen adrenal function. Let's just run a quick adrenal test. I'll show you some others in a moment. Hold the leg up. Don't let me push down. Hold. Try this one. Hold. Pretty good hip on the right. Let's put both arms to your side. Don't let me push down. We'll touch the reflex points to his adrenal glands. Not so hot anymore with that leg. That sends enough signals up to his brain saying, but wait a second, my glands are in trouble, that a previously strong leg muscle, hold strong, full strength each time, full strength, goes totally weak. What does that tell us? It tells us the last thing he should have ever done was get that cortisone injection, because that will weaken an already weak part of his body. It's already going to take his adrenals. Does cortisone make your adrenals stronger when you take it as a drug, Dr. Carr?
The opposite.
He's our medical doctor here, medical director. It's the absolute opposite. Cortisone as a drug causes adrenal atrophy. Where on the list of causes does it fit for the cause of adrenal shutdown? Number one in all medical texts for shutting down your adrenal function is using cortisone either by mouth, prednisone, or by injection. Cortisone, prednisone, all the different trade names. By the way, they got so many little ilones and isolones. They're all cortisone. And now they're so sneaky when they make names for these drugs, some of them don't even sound like cortisone anymore. You got to read the book. You got to read the insert to see that they got cortisone with like sneaky names that don't even sound like prednisone, cortisone, prednisolone, and all the things that ended in isone and isolone that gave it away in the past. Now they got sneaky ways of sneaking it in, and you think it's not even cortisone. And what does your doctor tell you? He probably didn't even tell you he shot you with cortisone, did he?
No, my sister did. She's a nurse.
She looked it up. It's a little secret they don't bother to tell you, because you might, hey, do you think you should know that if someone's going to shoot you up with cortisone? It should be a law, shouldn't it? Wouldn't they have to inform you of that? Oh, we're just going to give you this little injection, right? Is that what they did? They just gave you a little injection, right? Thanks, John. Good job. The cool thing about proprioceptive technique, the technique I'm showing you, is that if you know all these muscle tests and what they really mean, some of you have seen a technique called applied kinesiology, which is muscle testing. I have a gold certification in applied kinesiology. I've been through years and years of training. This is a turbo applied kinesiology technique. It's not in standard muscle testing. What I'm showing you tonight, proprioceptive technique, goes way past that. It's so much faster. It's the difference between an abacus and a 233 megahertz computer, because what we can do now is test, 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 and it tells us what's wrong and where to go and how to fix it, and boom, everything goes to strong, and then you know you're in the house. And then you have to what? Bring it through the healing period in the right position so the ligaments can heal. You want to understand the healing process for these old sprains, for these joints that have been jammed into misalignments that are shutting off proprioceptive nerves, ligaments that were microtorn. Now they've healed in the wrong place, most of them, because most people don't come to us in the first 12 weeks. They come to us way later. What do you have to do to fix these things? You got to work them into position, and you got to keep them into position. When I talked about broken bones, there's a whole different way to treat fractures than there is to treat sprains and nerve-related injuries. They require opposite care. Opposite. Do all doctors know this? No, they do dumb things. You have to immobilize a fracture. You put it in a big old cast, because if those bones are allowed to wobble during that 6-week period, you'll end up with a space there. You'll end up with a pseudo joint. In the middle of your arm, you'll end up with a joint. So they put a cast on it because you can't let bones not be close together and let them have movement during that 6-week healing time. You got to stop movement for a fracture. But here's what we learned in numerous scientific studies that most medical doctors don't know how to apply. You do not stop movement in a sprain. And yet, what's the first thing I like to do? Well, here's your blow-up sprain cast, and here's your carpal tunnel brace, and they want to, here's your, what do you call these? Sling, you know? They get these weird ideas about immobilizing sprains and ligament tears. You do not immobilize them. You must allow them to have movement, to heal. Did we let your arm have movement to heal? Heck yeah. Now, you guys who have had hand and arm problems, you go to a doctor and you say, "Doctor, it hurts when I play." And what's his stupid response? Stop playing. Isn't that what they always say? Joel, stop playing. One of my guys came in the other day and said, how about if I walked up to him and told him to stop practicing medicine? You know, what would he think? Yeah, I mean, what a dumb solution that is. Not only is it dumb, it's mainly wrong. You do not have to take a person out of playing to get them well. There have been numerous studies now on sprains and soft tissue. This is all called soft tissue, all this white stuff. Soft tissue injuries, if you've ever heard that word. That's stuff where you've torn up ligaments, or you've microtorn cartilages, or you've microtorn into tendons. When you've hurt the soft tissue, that's a soft tissue injury. Any of this white fiber stuff that's being overpowered and torn into. There have been studies done on soft tissue injuries. They take rabbits and they drill little holes in their knees. Scientists are so nice to animals. They drill little holes in rabbits' knees with drill bits. And then they let some of those rabbits walk around, and they put some of those rabbits in casts, and they put some of those rabbits in machines that make their knees move. Guess which groups healed and which ones didn't? The ones with movement heal. And the ones without never walked normally again. You see, when you immobilize a sprain, your body wants to heal ligament, which is linear white fiber tissue, all going in a line across the line of movement. But when you put a cast around it, it heals all helter-skelter with the fibers not going in line with the movement, and instead acting like one of those Chinese finger traps where you stick your finger in and you try to pull out, and now everything's pulling in different directions and you can't get movement. And what do we have to do with those guys? Tear them up. I send him into a room with my meanest chiropractor because I'm a gentle-hearted guy. And I say, it's tearing time for you, pal. I got a guy, he's a keyboardist. He had a gig in Thailand, and he was dumb enough to think he would learn to ride a motorcycle in Thailand. Let me tell you, I've been in Thailand a lot. Don't learn to ride a motorcycle in Thailand, because everyone you ever met who rode a motorcycle in Thailand has scars to show you. They are the world's worst drivers, and everybody on a motorcycle has been knocked off. So he decided to learn there. He fell off, shattered his arm, went to a Thai hospital. They're trying to fix him. He came to me, his arm's like this. The Veterans Administration says, we got to do surgery, we got to do this. You'll never use the arm again, it's going to fall off. They told him he was going to die. They told him his arm was going to die. It's a pretty good sales pitch for surgery. Your arm's going to die, they told him. First I did proprioceptive technique. First 5 minutes he's lifting his arm like this. It was frozen. And now I send him in the back with my most sadistic chiropractor, and I say, tear into it now. Now we got to get all the rest of the movement in there, because what's happened? This is what happened. Those dumb bunnies put him in a cast, and it all healed wrong. And now he's got a giant Chinese finger trap of crisscrossing white fiber tissue that we're going to have to rip all that up now and get him to start moving it so it can heal straight. Because your body likes to have motion. Somehow that tells it where the lines of energy should go so it can line those fibers up. In the absence of motion, it just goes, oh, well, doesn't matter, locks the thing down. So you got to get the bones back in place. And we want to adjust a carpal tunnel. I've got to reset the position. These two bones spread at the wrist. These flatten out. I got to put those back together. There's a strap of ligament here. That's got to tighten back down. I got to reset the tunnel back in here, put it back in place. That's got to heal back down. All those ligaments have to reheal. 12 weeks to reheal those. And you got to keep them in position. Move them into position, then keep them there to heal for those 12 weeks. That's why it takes some repetitive work. You don't just put it in after it's healed all wrong and expect that with one adjustment it's just going to go where it belongs. It doesn't do that. It's just not the way those things end up going. And do we take the person out of play? No. Here is the instruction I give my musicians when they're in the process of healing. You can continue playing, but try to keep your play below the line where beyond which, if you went over that line and played more, you cause yourself more pain or more inflammation or more symptoms, except where making a living or keeping yourself from going crazy demands that you must go over that line anyhow. In which case, we just have to deal with the fact that by causing more tearing, see, you want to have movement, but you want it to be fairly natural. You don't want it to be excessive, because at that point in the healing of those ligaments, excessive movement could re-tear. You don't want it to be absent, because if it's absent movement in the healing of those ligaments, it won't heal with the right lines of force. And as the healing progresses and the ligaments become bigger and stronger, you can do more and more. Which is why when we take care of a musician, he'll say, Doc, how long can you play without pain? 5 minutes when they first walk in the door. A week later, how long can you play without pain? 40 minutes. I'm much, much better. The other day, Emmy comes in and I've known her for what, two weeks? Something like that? Is it a month? It's a month now. And she says, I played, what, 4 hours the other night? Not with pain. As that line moves out, which it does naturally, you get to do more without causing any problem. Now, can a doctor tell you where that line is? I don't know how to tell a person where that line is. I don't know how any other doctor would tell you where that line is. You know, I'm not able to call the Psychic Friends Network and rely on them to tell me where that line is for you. You're the one who could best tell where that line is. And if you crossed over it and you caused more inflammation and more pain, then you know, hey, I better back down a little from there right now. And when you go, hey, I went a whole hour, it didn't give me any trouble, you know, and next time you play a little more, hey, it still feels good, I'm doing great. By the way, does the pain have to happen the minute you're playing? Not necessarily. For some people, it's 5 hours later, a day later. Brings us into another subject I want to cover with you, and then we're going to get into nutrition, and we'll be pretty much done. Does stress have anything to do with any of these arm and hand problems? It does. Is it some mystical mental connection? I don't think so. Probably not for most people. It has to do with these things called your adrenal glands. Now, I will let you know that there is a whole other workshop devoted just to understanding adrenals and their relationship to blood sugar and their relationship to inflammation. And it takes me a good 90 minutes to really explain this subject well. And we don't have that tonight. We're going to take 5 minutes and just touch on it as it relates to musicians. But a person's adrenal glands, two little glands that sit on top of your kidneys, one of their jobs is to put out the body's natural cortisone, the hormone, not the drug, which is the strongest anti-inflammation, anti-pain, anti-swelling, anti-redness, anti-heat, anti-inflammatory substance in the universe is cortisone. And you better have your body being producing this right and correct small amount of that little powerful hormone all the time. Your body's supposed to produce that cortisone, just like it's supposed to produce the hormones from the adrenals that keep your blood sugar up so you don't have hypoglycemia, so you're not exhausted, so you're not fatigued. Like it's supposed to produce the other hormones that balance your salt, the hormone adrenaline that performers use when they want to get out on stage and kick some butt. Adrenals produce a family of hormones, but an important one to players is cortisone. You can mess up adrenals in numerous ways. You can do it by mentally stressing. You can do it with lack of sleep. You can do it by eating too much sugar, too much Coca-Cola, too much cake, too much carbohydrates. You can do it by overeating pasta and grains. You can do it by overpowering the blood sugar system with too much quantity of sugar. You can do it with coffee, you can do it with alcohol, you can do it with cigarettes, you can do it with nicotine, you can do it with stimulant drugs, you can do it with cocaine, and you can do it with speed, you can do it with methadone, you can do it with dexedrine. There are a number of substances that will push the adrenals and fatigue them, and there are a number of things you can do just out of well-intentioned ignorance and blow your adrenals out of the water, even thinking you were doing a good thing for yourself. Just overeating Italian bread is an adrenal stress factor. Now, there's a lot to them, and I'm not going to cover it all tonight, but I want to cover some of the important things, which is, as it relates to musicians, if your body is low on cortisone, you're in inflammation looking for a place to happen. And if you're strumming 3 hours in a row, what place might your body decide to put that inflammation? It's not a tough pick. If you're a vocalist and you're screaming, where might it put that inflammation? It's not a tough pick for the body to take the most stressed part that you're overusing compared to what it might have been designed to do and take the deficiency of the substance that should be suppressing inflammations and keeping your tissues in good health and let them get raw and red and inflamed and swollen and give you a hard time. And is it important to fix adrenals? Vic wouldn't be a happy guy today, nor would a lot of my musician patients ever be happy if we didn't test their adrenals, find out which of them had wasted adrenals. Some of them are a little low, some are very low, some are shot. There's a certain group of patients, even musician patients, who have a severe adrenal problem called ligament stretch syndrome. I'm sure we gave you the handout for it tonight, or if we didn't, we'll hand one to you, that explains this problem. And if you read it and it sounds like you, it probably is. And these are people who never really get out of problems. Their pains are always there, and it goes from here to there. And sometimes it's their shoulder, and sometimes it's their wrist. But if they go out and skate, it's their knee. And if they try to play racquetball, it's their foot. And they just go hiking, and now it's their hip. And they can't figure out why they're so old and they're only 32. And it doesn't matter what age you are. If you blow the adrenals to such a low point where you're even not only just not low on inflammation, you now don't have enough steroid output from your adrenals, that your steroids aren't even holding your soft tissues together and your ligaments are really falling apart, you'll have something called ligament stretch syndrome. Is there anyone here who has been diagnosed with fibromyalgia? They're so chronically depressed, or they've got multiple areas of injury and they don't even understand why so many parts of their body are crapping out on them. If they know chiropractors, they feel like they always need a chiropractic adjustment but can never hold one. They just can't hold an adjustment. Is there anybody in this group sound like that? Doesn't have to be. It's not the most common thing, but let me tell you, when a person has that problem, it'll ruin their life. Did it wreck yours? It starts to ruin one's life to have that much going on when you're just depressed and feel horrible and nothing gets well. I don't have anyone to test on that tonight, but I gave it to you to read, and some of you know people with that, and you do them a great favor if you tell them how to fix it up. First aid. If you injure yourself and you find yourself in pain, you're playing and you find yourself in pain, some of the best first aid is nutritional. Nutrition is really the right medicine. It's the medicine of the future. Drugs are the heavy-handed medicine that you hope you will never, ever use. Medicines. But nutrition is really the medicine of the future. Why? It deals with causes of things. Is there nutrition if you have pain and problems? Awesome stuff. I gave you a little write-up on something called the Neuromuscular Trauma Kit. 3 nutrients I would never live without at home. I don't recommend anyone who wants to know anything about nutrition lives without having these at home. Ligaplex, Mintran, and Cal-Ammo. That little sheet will tell you how to take those. If you sprained an ankle, if you fell off a horse, if your friend got in a soccer injury, if you injured, sprained, hurt, fell, accident, car crash, any which way, you follow that right up and take these 3 nutrients, power them into your bloodstream, and you will get relief of nerve pain, joint pain, and you will speed the healing of tissue. You'd say, well, you know, I can just go to the drugstore. Why should I keep this stuff at home? And I can buy some Motrin, and it gives me some pain relief. Read 10 studies I'll give you from medical journals that explain how non-steroidal anti-inflammatory drugs, which is Motrin, Advil, and a whole group of them now, while covering up the symptoms, sabotage the body's ability to rebuild what? Soft tissue. To rebuild what? Ligament. So what do? You cover up the pain, but you delay the entire healing process. What a good deal, huh? How about if you could get rid of the pain as effectively or more so while healing the tissue at a faster rate? Tough choice, huh? That's the advantage of nutrition over drugs when it comes to healing these damaged tissues. You get into a newly torn up injury, and now it's all swollen because it just happened today. There's another nutrient to use in addition to the neuromuscular trauma kit. While there's still active swelling, you want to speed your ability to use that ankle or that wrist or that shoulder or that neck again, but it's all swollen up and painful. You take the neuromuscular trauma kit and you also take this stuff called Biozyme. Do not keep this one at home. I'll recommend you to keep these at home because they last for years. Just don't put them in the sun. You'll use them long before you throw them away. I've never not used neuromuscular trauma kits. I've never known my patients to go, geez, I never got a use for that. Somebody you know is going to be hurt and you'll say, here. Hopefully not you. Don't keep enzymes at home. They don't keep. These keep. But enzymes are living materials and they have horrible shelf lives and they will only last about 6 months and they go downhill. And you only can buy enzymes from a place like me that turns them over all the time, just like you don't buy batteries from a place that doesn't sell batteries. If they're blowing dust off the batteries to sell them to you, you don't buy them there. And you don't want to buy a place that's blowing dust off the enzymes because these guys have to be fresh and only a few companies know how to make them. Don't think you're going to run out to the health food store and say, I need enzymes and have a real good hope of getting a good product. Most enzymes are not strong enough and biologically active enough. There are only a few companies that really know their stuff when it comes to enzyme manufacture. This is one of those companies, Metagenics. And this is an amazing product for dissolving, swelling out, clearing that cellular debris, letting your body munch all those spilled proteins from all those cells you just tore up. Because when you think about it, if you go and knock down a building because you're going to build something new, somebody's got to carry all that garbage out, all that broken lumbar and all the bricks that are torn up. Someone's got to cart that away and wheelbarrow that out of there before you go and build something new. And when you go and tear a bunch of ligaments and it's all swollen in there and all that stuff's pus and full of water and gook, you got to get that gook out of there. You know, you get a knee and it comes in here and it's all blown up and it's the size of a basketball. And they say, well, you know, I saw my orthopedist about this because this is the 3rd time it's happened. Every time I play basketball, it seems, you know, at least once a season I do this. And I go to my orthopedist. Well, he's the best guy. He takes care of the Lakers. And he sticks a big old needle in there and he drains the gook out. How does it feel? It hurts. How much does the swelling go down? Incomplete. Does it still hurt 2 days, 3 days, and 4 days later? Yeah. Is it still swollen? Every time. Does sticking a needle in there and dragging the gook out actually fix the problem? It doesn't. But I'll tell you what will outperform that every time. You take 3 of these biozymes 3 times a day on an empty stomach, and they'll go into the bloodstream, go into that tissue, munch up those proteins, break them right down. That'll suck it right into your lymphatic system, and that swollen knee goes down to 0 in 24 hours with no pain, no puncture, no damage. You know, it's trauma to stick one of those big old needles into a knee, and it doesn't even work. Enzymes outperform it and cost a fraction. I mean, there's no question. Nutrition is the real medicine for these kind of things. But these you'd have to shoot over it, you know, when a place like us is open, grab them, get the right instructions, take them on an empty stomach. This is not one to keep at home. You want to know another couple nutrients that are helpful in these issues? Bioflavonoids can be very helpful. They have a strong healing effect on soft tissues. In general, we can use a product like this, 500C methoxyflavone, which has a huge ratio of bioflavonoids to vitamin C. You say, oh, I've got vitamin C with bioflavonoids at home, but you read the label and it says 500 milligrams of C, 35 milligrams of bioflavonoids. This is 500 milligrams of C, 500 milligrams of active bioflavonoids. Totally different ratio. We use this kind of product when we want very high bioflavonoid content to speed the healing of soft tissues. Exercise. Exercise does strengthen damaged tissue. And in California, we're exercise freaks. A lot of people believe in this state that exercise will cure everything and anything. And you have to exercise in California. It's a law. However, you have to understand where exercise fits into the picture of these kinds of problems. People think, I got a problem in my wrist, I'll exercise my way out of it. I got a problem in my knee, I'll just go into the gym and I'll exercise my way out of it. Here's the problem with that. When a knee is twisted or wrist bones are out of place, and all you do is just keep moving that thing 2,000 times, what do you end up doing with a joint that's malpositioned? Grinding on it. What do you end up doing? Tearing up the cartilage. If you had a hinge of a door that was slightly off position, you couldn't cure it by opening and closing that door 20,000 times. In fact, all you'd find is a bunch of metal filings under that door because you just were grinding away at those hinges because someone had torqued it. Does that mean exercise doesn't play a role in healing these things? Not at all. Here's how these things heal. Phase 1 is called relief. Get the person enough into position where the nerves are no longer compressed and the signals are getting through. Suddenly the screen goes clear. Muscle strength comes in first. It's the first thing we'll find when we treat a person. It'll usually start day 1, minute 1. Doesn't it with you guys that I've treated? Don't you see strength changing minute 1? Instantly you see strength change. Then there has to be more healing of the tissue to hit full relief because that's when the pain clears up. And that's called the correction phase. You follow up past relief after you've gotten everything now in position. Maybe you're 3 weeks, 5 weeks into treatment. The person goes, this is great, man. I feel like new. But are they healed at 5 weeks? No. The ligaments haven't rebuilt even at 5 weeks. They're only less than halfway there. You follow through making sure that there's enough movement and correct position, good nutrition, the ligaplex is going in, the Mintran's going in, we're rehealing the ligaments with ligament repairers, strong mineral products. These are the minerals we use not just in acute injuries, but we'll drop out the cal-ammo for pain. When the person's no longer in pain, just use ligaplex and Mintran and just heal the tissue with those minerals. Speed the healing of that tissue. Does it help? Dramatically. And then you go through the correction phase. That's phase 2. Then you come to phase 3, which is called strengthening. Strengthening is where your muscle work will now pay off because the joints have healed, the bones are where they belong. The ligaments have healed. They've now got reasonable ligament strength. The nerves are now working, so the software is getting the information back and forth, and everything's functioning. And now you can take muscles that haven't had strength because you weren't using them right, you weren't able to get the power out of them, and do your playing, do your strengthening, and it will pay off. And that will even impart greater strength to those joints so they're less likely to be hurt in the future if they have good muscle integrity. If you got good nutrition now, everything's working, nerve signals are in, everything's good, and now you strengthen the muscles, you're in the best possible condition to maintain yourself with what? Good exercise, good nutrition, making sure that everything stays cool in there. Nutrition plays a key role in these. I would always recommend to anyone who this isn't an unaffordable luxury, because I think it's not so much a luxury as just intelligent health care. See, a lot of people think nutrition is some kind of luxury. It's a luxury if you can't afford it, I suppose. But compared to what? Compared to falling apart and having to go through all the expenses that go with things that fell apart? It's a cheap way of staying together. It's not an expensive luxury. It's the least expensive way to hold yourself in good order. So, you know, you want to budget good nutrition into your life because that's what gives you longevity without trouble. And one of the things you want to keep going on is good ligament nutrition, bone nutrition. Those things are real nice and very important. I work out with a trainer and he's like, why are you taking these minerals? How come you don't hurt after you're doing all that pec work? All my other guys are hurting. You must be cheating. You're taking these nutrients. You're cheating. You should be feeling more pain. He really says this to me several times. Then 6 months into it, when this bass player that he's training has a torn up shoulder, and this black athlete who's 26 years old that he's training pushing the same weight as me has a torn up wrist, and this other guy has a hurt low back, and I don't have any of those injuries, he says to me, now what are those things you're taking? See, that kind of prevention is smart, because what you're doing is you're imparting strength to tissue so that when you do what it is you want to do, you don't tear yourself up. You're not an accident looking for a place to happen. That's prevention. Exercise, some specifics on it. I told you about extension. Most of your playing is done in flexion. Your fingers, you're operating in flexion. You got a couple ways to do extension. You can get a rubber band. This isn't the greatest one, but get a big fat rubber band. This one's too big, but a big fat one, and put it around your fingers and do that. What is that doing? It's working your extensor muscles. That gets easy. Put another one around it. Get this kind of hand putty. We have it here. Flatten it out. This is like that silly putty stuff. You used to play with that when you were a kid. They make it for hands because you can squeeze it, but again, when you're squeezing it, you're working in flexion. What's the exercise you can do with extension? Spread your fingers into it and spread the stuff out. And now you work your fingers in extension, balancing out the nerve system and the muscle integrity so you don't have your flexors only working, you're working the other system of nerves and the other system of muscles. You can add extension exercises to nearly every musician and you'll strengthen their overall playing. Particular musicians' hazards. You've got lifting. A lot of you guys are going to lift your own equipment, putting amps into the backs of cars. Don't lift improperly. You bend over from the waist and lift wrong even once, and you blow out a disc, let me tell you, your life will not be the same. You will not know the meaning of pain, hassle, and wasted money like you will learn it if you herniate a disc. And the number one stupid way to herniate a disc is to not know how to lift and follow it every single bloomin' time you lift anything. Get close to things, lift with your legs. And if you can't do that and you got to bend over and lift from the waist, you're just playing Russian roulette with your discs. You're just wondering whether you're going to blow it out today or not. I don't know why anyone would want to take that risk. If you ever met a person with a herniated disc, boy, would you think twice about ever doing that. Smoke, you definitely have problems playing smoky places, inhaling secondhand smoke. I just finished our seminar for vocalists. It's available on videotape, and it covers a lot of cool stuff on vocal health, things we didn't touch on tonight. But there are nutrients that you can take. Things like pneumokeratin comes in a bottle like this, and excellent products to strengthen mucus linings and keep them from falling apart, keep the lungs and lung tubes properly nourished, correct herbs and so forth in it. Oh, I didn't mention this one, I should. Easy Flex, which is a formulation for carpal tunnel syndrome sufferers. There have been numerous scientific studies that show that if you just bring in certain parts of the B complex, you can cure a percentage of carpal tunnel people with that alone. But this is more than that. It's got the B complex, the ligament repairs, and everything for carpal tunnel. So when we have a carpal tunnel person that really tests positive on carpal tunnel testing and all the medical tests for carpal tunnel that we run, as well as my proprioceptive test, we give them some Easy Flex in it, and it speeds the healing of wrist and carpal tunnel injuries. Instruments I mentioned have their own problems that you may need to understand, compensate for, or know that you may have wear and tear in those areas, and you need to pay attention to making sure you do the right things for yourself relative to screwing up your neck with straps and so forth, or how you hold an instrument. It's going to require some care, or you're going to end up with problems. Drugs and alcohol, I don't have to beat it to death, but those are definitely not health enhancers. People who abuse those immensely end up with a lot of trouble. Alcohol is a #1 way and a very efficient way to blow out the adrenal glands if you put a lot of alcohol away. It's not too hot for your liver, as you probably know too. And dietary deficiencies we touched on. If you don't have minerals in your food, if you're unbalancing your foods, you're going to end up with this soft tissue system imbalance. If you don't have the right minerals, you'll end up with your nerve system imbalanced. If you don't have the B complex and you don't have the calcium magnesium, you got nerves doing all kinds of wacky stuff. And if you don't have the right minerals, manganese, and all the things that you need to nourish ligaments, you're going to have ligaments that fall apart. And then you're going to wonder why your hands are killing you and the other people in your band, their hands are okay. What I wanted to cover with you tonight is understanding. Get some concepts on prevention. That's always the #1 thing. It's much better to prevent a problem than have to fix it. Then we went through how to understand, once you have a problem, how to best test it, how the proprioceptive technique will isolate these things and home right in and give us the right answers on how to fix them and allow us to make corrections. Because if you want to stay happy and you want to stay creative with your art, if you have this living body of yours collapsing in some key area that you need to practice your art, how are you going to be a happy artist? It's a drag. So that's where being able to maintain or correct problems that occur in your physical health sanely with things that work, rather than using approaches that can be destructive, harmful in the short run, long run, destroy your own adrenal glands, wear down your tissues, cut into things, have adhesions from stupid surgeries you never needed. That doesn't make sense. You want to find the causes of things, do things that directly deal with the real causes of problems, and then you're way ahead of all this symptomatic treatment that has been the way of the past, I would say. I think we covered just about everything on my outline here. For those of you that have never been patients, we've given you one of these health passes. What this does is you can use it, you can give it to your friend, you can give it to a member of your band, you can give it to your mom, whoever you want. It says, we gave you a couple of them, it's a $150 value. You get a free consultation where you come in, talk to us about whatever health problems you've got, a free 10-point examination. We'll test your problem areas and see what shows up. Is there a problem going on there that we can identify? Does it look like something that can be fixed? What's the best way to go about fixing it? A free x-ray if you need it of the problem area, so we shoot one free film and see what's going on in there, and then go over a report of those results so we can tell you, here's what our test showed, here's how that relates to what you got going on, here's what your x-ray looks like, this is what's happening there. And if it's something we can fix, we'll tell you we think we can fix it and answer any questions you have about costs or time or what needs to be done or whatever like that. And all that's free. I don't put pressure on anybody. Those of you who've been here for health passes know I don't put pressure on anyone. I don't need to put pressure on anybody. This place is always jumping for starters, and I don't believe in putting pressure on people, because how am I going to fix someone who doesn't want to be here? I mean, health is a team-up process. You got to both be on the same team. So if they're like, I don't really want to be here, what's the point of conning someone into something they don't want to do? It doesn't make any sense to me. So I don't put any pressure on anyone with these things. We just say, okay, here's what you say. Here's what our test showed. Here's what this x-ray says. This is what we would recommend you do. And if we think you should treat her, we'll let you know. If we think you should do something else, we'll send you somewhere else to do what looks like is the right thing for you.